Good afternoon, Miss Lee.
Good afternoon.
My name is Journey Williams. I will be your CNA for today, and today I'm just going to be providing you with a little bit of range of motion. I'm going to give you a modified bed bath. Is that okay with you?
Yes.
All right, so I'm going to make sure that I provide privacy for the patient by closing the curtain and the door. I'm going to wash my hands, put on my gloves, making sure that the bed is elevated to a correct working level. The brakes are locked. The side rail is lowered on the side that I'm working on. And then I'm just going to start by giving the patient hand hygiene. So if you would please place your hand into the basin. Applying the soap to the patient's hands. You can rub your hands together.
That's a lot of soap, miss.
I'm sorry. And then assist the patient to dry their hands. You can hold it.
Thank you.
All right. All right, we're gonna move right on to mouth care. So if you hold this for me, please. I'm gonna drape you, make sure you don't get any spills. I'm gonna wet the patient's toothbrush with water. Adding toothpaste to the toothbrush. I'm gonna brush all surfaces of the teeth, starting with the bottom. Making sure to move gently. Move to the top. And then the tongue. I'm gonna assist the patient to spit. Drink the water first. Would you like to spit again?
Yes, please.
Mm-hmm. Okay. Then I'm going to floss the patient's teeth. I'm not going to floss on video, but if I were to floss, I would use C motions curving around each tooth, making sure to be careful not to hit the gums or any sensitive parts. I'm going to offer mouthwash to the patient. Would you like to use mouthwash?
No, thanks.
Okay. All right, and I'm going to go ahead and start your modified bed bath. Making sure that I wet the washcloth. I'm going to start with the inner aspect of the eye, moving to the outer aspect of the eye, using a different part of the rag each time. Washcloth. Wet it again. And do the same thing on the other eye. From inner to outer. Again, using a different part. And then I'm just going to move on to washing the entire face, neck, and ears. Rinse out the washcloth. Okay, and now I'm going to move on to the hands, arm, and underarm. So I'm going to place a towel underneath the patient's arm. Okay. Making sure to expose only the part of the arm that I'm going to be washing. Okay. So I'm going to get the washcloth. Apply the soap. Work it into a lather. Starting with the patient's hands. Washing the surfaces of the fingers. And the hand. You stay right there. I'm going to provide nail care for the patient. If you'll place your nails into the Mises pan, please. I'll let them soak for the proper amount of time, which is 15 to 20 minutes. I'm going to use the blunt end of the nail cleanser to clean underneath the patient's nails. Remove it. Place it on top. Cleaning underneath the patient's nails, making sure to never use the pointed end. After that, I'm going to make sure that I use the clippers to cut straight across. For sake of this video, I'm not going to cut, but I would cut straight across, never cutting on the sides. And I will always remember never to cut the toenails because the patient could be diabetic with poor circulation. And then I'm going to use the orange wood stick. I will use the smooth side of the orange wood stick to smooth out any rough areas, and then the rough side to buffer out any rough areas. For sake of the video, I'm not going to do it. Okay, now I'll move on to washing the rest of your arm. Put some soap on the washcloth. Making sure to clean the patient's wrist, up the arm, in between creases. Making sure to support and not to overextend. And then clean underneath the patient's arm, again, not to overextend. Using a different part of the rag each time. Okay. And then I will dry. I'm going to put emollient on the patient's nails. And soap on the patient's hands. And if desired, on the arm. Would you like soap on your arms?
Soap.
Lotion. Sorry. Lotion on your arms.
Just a little, please.
Okay.
It smells good. What kind is that?
This will be lemongrass and sweet orange. Readjust the patient's clothing if necessary. Okay. Now I'm just going to dispose of all of the linens that I've used. And the containers. All right. Now I'm just going to provide the patient with range of motion on one leg and one ankle, one knee and one ankle. So first I'm going to assist the patient to flex and extend. So flex, 2, 3, okay. Now moving on to the ankle, we're going to go midline first and then lateral, midline again, lateral, and one more time. Good. And then we're going to do dorsal flexion, which is towards the leg, and plantar flexion. One more time. And one more time. All right. I'm going to recover the patient. And now I'm just going to turn you onto your left side, okay? So I want you to cross your right leg over your left leg as carefully as you can. And cross your arms over your chest. And then on the count of 3, I'm going to support. And you're going to turn towards me and we're going to assist you with pillows, okay? 1, 2, 3. I got you. I'm not going to let you fall. Okay? I'm going to place a pillow behind the patient's back. In between the knees. To promote proper body alignment. And underneath the arm. And recover the patient. Afterwards, I'm going to make sure that I lower the bed to its lowest level. I would place the side rail up, make sure the colli is in reach of the patient, make sure that my area is neat and clean. Again, replace all of my equipment and supplies, remove my gloves, wash my hands, and report any abnormalities.